You're listening to Ask Dr. Jake. My name is Dr. Jake Tucker. I'm the owner and founder of Good Life Family Chiropractic here on the south side of Lincoln. And today we're coming to you with another message here with hope, health, and wholeness. And I wanted to share a little story with you guys today about a patient that came through the office just this week. She actually works in the healthcare field and, even worked for a chiropractor in the past. But about 10 years ago, she was in a car accident and wrecked her neck pretty good. You guys have heard of whiplash. She had it from just about every direction, and it was pretty obvious after the accident that she needed some help. She needed some chiropractic care. She needed some massage therapy. She needed some e-stim. She needed some physical therapy. You name it, she needed it at that point. And she actually went in and she got some. And fortunately, working in a chiropractor's office, she was able to get a lot of chiropractic care. Now, unfortunately, other than the initial x-rays, this chiropractor never took secondary x-rays to follow up. And so once the pain was gone, she stopped getting adjusted. She would get adjusted about maybe once a month, but basically stopped her chiropractic care because the pain didn't hurt anymore. And this is a major problem that we have in our country, in our culture, when it surrounds health. If we don't feel bad, we don't do anything actively. And even the chiropractors, sometimes they're not doing enough to make sure that we have healthy spines. And nobody is telling you to take care of your healthy spine except for here on this show because of how important it is for our health. But over the 10 years since her accident, her health has taken a dramatic turn for the worse. She started to develop mental anxiety, depressive disorders. She actually ended up in a mental institution for help to get herself back on track. She ended up with digestive disorders where her metabolism dropped and she wasn't digesting food properly and started to create all of these health issues. Now, fortunately, I met this gal a couple of weeks ago, and we sat down, we had a conversation, and fortunately for her, in spite of her difficult financial situation, we were able to make it work out so that she could come in for an exam. And I sat down with her, and we discussed what was going on with her health, and I could see that her posture was about as bad as you can expect for somebody that spends their day looking down at people. And so, what had happened is her spine, which is supposed to be straight and tall, basically head over top of your shoulders when you're looking at it from the side and directly between your shoulders when you're looking at it from the front, had adapted the posture of both the car accident and the habitual posture that she takes on a daily basis. And what that was doing is it was creating an intense amount of stress on her spinal column. On specifically the spinal cord itself. It's a pathological tension that when you lose the curve in the neck, it places there. And so it was creating pain in her hands and arms and shoulders. Her low back was dealing with a lot of issues. And fortunately, I was able to find the cause of the problem, find the cause of all the problems. The top bone in her neck had been wrapped around her brain stem, and her head was cocked over to one side and so far forward. So, I get to give her hope because no one's ever sat down with her. No one's ever taken these X-rays for a second time to make sure that she's still improving, that she's still getting healthier. She may have felt better in the short term, but ultimately, if we don't make sure that someone's healthy for the long term, what are we doing as doctors? How are we keeping people healthy? And so, just like I'm able to sit here and give someone hope that has bad discs, a bad spine, pressure and damage on the spinal cord, I want to give that to each one of you. And so if you're sitting there right now and you're sick and tired of being sick and tired, if you're in pain and you're sick of it and you just want to be well, if you just want to feel well, I encourage you to pick up the phone and call our office, 531-289-7100. We're standing by to take your phone call and help you get back on the path to wellness. And when you call that number today, for the first 5 callers, we're going to be giving a 50% discount off of the exam, off of the imaging, and any necessary x-rays that we need to take. The most you would pay for your initial visit is $65. Huge savings when compared to doing the exact same exam in a medical office. And we don't even have to worry about your insurance with an exam cost like that. I took my son in for his annual physical. I could have done it. But he's going to kindergarten this year. And so we thought it would be a good idea just to have somebody else take a look at him, get it outside of the family a little bit. And we went in for this wellness exam. And we use Samaritan Health Ministries, where we're sharing healthcare costs with a number of Christian families across the country. And so they don't cover well visits. And so I have established with that office that we get a cash discount, but even with the cash discount, it was $180 just for a well check. Basically, for them to tell me that his pulse is fine, his blood pressure is fine, his oxygen rate is fine, his height is fine, his weight is fine, and then look at a chart and tell me exactly where he is compared to his peers. And he's completely healthy. He has no complaints, but it costs $180 for an exam like that. But to actually get to the cause of your problem here today, if you pick up the phone and call our office right now, setting up an appointment for this week, I'm going to give you a 50% discount if you're one of the first 5 callers, and you walk out of here for no more than $65. And there's no cost to go over those findings either. I may take another appointment and bring you back, but sitting down and going over those together is no additional charge. I want you to know what's going on with you, but more important than that, I want you to have a path to correction. And that's what we specialize in here, is actually getting people well, getting people back together. And migraine headaches, low back pain, neck pain, those are simple problems. Not easy, but they're simple to deal with. It's about addressing the cause. Health is easy, or sorry, not easy. It's simple, but not easy. It takes work, just like anything that's worthwhile in life. If you want to be healthy, whether you're dealing with aches and pains of age or arthritis, or you're dealing with cancer, heart disease, diabetes, Alzheimer's disease, dementia, a lot of these things you can see improvement in just by addressing the cause. There's simple principles that we teach here in the office, but it's not easy. And the first reason why it's not easy is because it's countercultural. Our culture teaches you, and even the doctors, when you go to their office, they're meeting you where they're at, and they're saying, basically, let's just take care of the symptom. Let's just make you feel better. And so they'll give you a medication. And what does that medication do besides cover up the symptom? It hijacks the chemical process that's going on inside your body that's actually creating the pain, and it blocks the chemical that is released that actually creates the pain. It doesn't do anything to aid in the healing process. In fact, what we see is more often than not, when you take a medication to deal with a condition, it actually extends the duration of the illness or the ailment that you're going through, the diagnosis. Some of these things, and I'm really surprised to see just how often things are being advertised on TV right now for drug companies and medications, because they're immunosuppressants so often. They're suppressing your immune system. When we need the immune system to be healthy, we're actually creating a process artificially that lowers your immune system function overall. But it's a huge cultural issue that takes us away from what health really is. No definition of health in the world defines health as the presence or absence of symptoms, making you feel good. And we all define health on how we feel. If we look good and we feel good, we assume that we're fine. I get in trouble with this too, because I was raised in this culture. I feel like if I feel good, I must be fine. But if I'm not proactively investing in my health, I can absolutely start to lose my health, even if I feel good. And I see this over and over. We see the examples of this all the time. We see actors and athletes who out of nowhere get sick, get diagnosed with cancer, get diagnosed with a heart condition. And we assume that they're genetic because that's what society and culture tells us. But the research shows us that less than 15% or less than 5% of the time, that's true. Less than 5% of the time is cancer or heart disease a genetic condition. Yes, your doctor might have said it's genetic, but that's just because that's what they assume, because they don't know where it comes from. When you realize where cancer comes from, and according to the Journal of Pharmaceutical Research, it's due to lifestyle choices that we make, things that we do to our bodies, things that we surround our bodies with, things that we don't do to our bodies that actually lead to cancer, heart disease, diabetes, Alzheimer's, dementia. And if you lifestyle your way into a problem, you can lifestyle your way out of a problem. But it starts with understanding what health is and where it comes from. Because you can jump on I-80 and travel west and hope and have all the best intentions in the world that you're going to end up in Miami someday. But if you're going west on I-80, is that ever really possible? It's not. And you can have all the best hopes and intentions for getting healthy, but if you end up in the wrong office with the wrong healthcare provider, or you never even start making the choices that you need to make in order to get that change, it doesn't matter your intentions. It doesn't matter your hope. So we have to start with what health is. Health, according to the World Health Organization, is a state of 100% optimal function and healing across mental, emotional, and physical components. I like to add spiritual in there as well, because there is no way to be healthy unless you're spiritually healthy. But then it's like, okay, so where's our healthcare system fit into that? Well, according to what's considered medically necessary by Medicare, Any care that seeks to prevent disease, promote, or enhance the quality or longevity of life is not considered medically necessary and therefore will not be covered. And so literally the healthcare industry is conspiring against us to keep us from being healthy if we're giving them responsibility for keeping us healthy. But if we take that responsibility, if we're the ones that take action on this, if we are proactive, then we can keep our function high enough. And don't rely on how you feel with this, because for you to feel a symptom, you have to lose 40% function, with 0% function being dead and 100% function being life and health and vitality. But what controls that function? And that's actually where the central nervous system comes in. Because when God designed you, it was a miracle, literally a miracle. He started with two cells, the sperm and the egg. They came together inside your mother's womb based off of that innate intelligence that God provides for procreation and reproduction. And those cells came together and they started duplicating and replicating themselves 36 trillion times, differentiating themselves into every organ, cell, and tissue in your body. It created the brain and the spinal cord first. And off of the brain and spinal cord grew these nerves, basically branches of a tree that grew out. And at the ends of these limbs, off the ends of these branches, grew every organ, cell, and tissue in your body, because the intelligence that God put inside your body, that's innate. That's innate intelligence. That's inborn. That's his laws and principles at work in action, creating and forming you. Now, that intelligence, it didn't leave, right? Because your heart beats without you thinking about it. Your lungs breathe without you thinking on it. You digest food without doing much more than thinking about putting it in your mouth. And miraculously, all of a sudden we get this urge when it's time for it to come out the other end, and it's fully digested with all the nutrients pulled out of it. It's incredible how God designed our bodies. That intelligence resides in your central nervous system. It's what keeps your heart beating. It's what keeps your lungs breathing. It keeps, it heals a cut on your thumb or your hand or your arm or your leg, all without you thinking about it. It doesn't need Neosporin. It doesn't need a Band-Aid. It doesn't need a surgery. It doesn't need a drug. It does it all on its own. And then to protect it, God created the spine, the spinal column, and every individual vertebra surround and protect the brain stem, the spinal cord, and each of the nerve roots. And it has a normal position, just like you have a normal temperature, blood pressure, pulse rate, respiratory rate. You have a normal position of your spine. It should be straight up and down from the front with 345-degree curves from the side. In this position, there can be no pressure or damage to your central nervous system. But the problem comes when you move this out of alignment. If one vertebra is out of alignment by even 2 millimeters and 2 degrees and restricted, left there for 5 minutes or more, it reduces the amount of flow of information between your brain and your body by as much as 60%. Just 5 minutes of that. And I guarantee if you turn your head to the right and you can't get your chin all the way over your shoulder, and you turn your head to the left and you can't get your chin all the way over that shoulder, you can't touch your chest with your chin, you can't look all the way up and back at the ceiling without pain, there is a misalignment there, and it's interfering with that expression of health. If you're feeling that right now, call my office, 531-289-7100. Remember, that's a 50% discount today and every day this week for those that call, that make an appointment for this week. I'm Dr. Jake. I'll see you again tomorrow for another episode of Ask Dr. Jake.